I have no money to buy it now.
I don't know if I
Huh?
see. On Thursday, the Nigerian government received 846,000 doses of the R21 malaria vaccine. This is the first batch of the vaccine to be sent into the country since it was approved in October 2023 by the World Health Organization. Today, we'll be speaking to Nigerians on the street of Abuja to get their opinion about the vaccine.
Just like I said I recommend every child, so long you're an African, you're a Nigerian, you are supposed to have a right to this vaccine because it's a pandemic we're all suffering. In fact, I'm treating malaria as I'm talking to you.
Yeah, I've heard about the new vaccine, even though I myself haven't gotten vaccinated yet, but I've heard about the new vaccine, and I think it's a good thing. Like, if I even say it now, I'll go for it, because not quite long, I just got myself treated of malaria. Like, I'm still on treatment. I'm treating myself of malaria. So how I wish I have been vaccinated, at least it will have reduced the effect, the side effect, or the way the malaria would have weighed me down.
Yes, a working development, yes. Because malaria is affecting this. Malaria is mosquitoes everywhere. If you go in the rural areas and inside, you see how people are suffering because of malaria.
It's going to be very, very helpful because the rate at which people contact malaria, the rate at which people contact malaria in Nigeria.
First thing first, I want to argue why the government bring only for children. We used to have malaria all the time now.
So, and if you check around currently now, what's going on now, almost everywhere now, malaria is like, it's now a common thing due to change of weather, the environment, and the rest. So being vaccinated is a good thing.
Last time I treated the malaria, it was people that help me. So I don't know how people in the rural area will how they will. You understand? Yes.
So it's something every child, every adult, in fact, every Nigerian should have access to. It should be like a free gift to us. Because the government is not giving us anything free. They should give us this one free now.
In my own opinion, I think it's a very good thing to get all the children vaccinated because if you check, malaria easily weighs children down compared to adults. An adult can live with malaria infection inside. It's just like a virus, just like an infection. It will stay inside you for long before it shoots out. So in terms of children, it easily comes out, like it easily gets them down.
There are some vaccines that consist of antibiotics, and whenever it's excess of it in the system, it affects everyone in a long run. That's why a lot of people will not want to talk about being vaccinated because they believe that it has some antibodies like antibiotics that affect the system in a long run. That's why people view vaccination as something harmful, that has more harms than good.
God has said that the herbs and the trees and all that He created would even be for our food and our medicine. Okay, so it is done in such a way that we can easily administer it for prevention, and prevention is better than cure, so it is okay.
That's one very funny thing with, let's say, with we the black-skinned people, or with the Africans. Let me put it that way. With the Africans, we believe on, they say this, we say that, we say this. But one thing I will tell you is your government will never introduce what is not good for you. So whatever the government introduces for the benefit of the people. So government will not bring what will kill its own people, what will come and, what would there be benefit in taking the lives of children?
If I am to be vaccinated from malaria, I would like to know more about the vaccination, and I would like to know more about the content of what I am being vaccinated from.
If vaccine is not efficient enough, we have drug agencies that have gone through research to see that yes, this thing is so good. So introducing it to the country, there's no way the health management will introduce what is not good to a country.
The administration of the medications in this part of the world is a little bit, below, standard because of the number of doctors per thousand or per million. We don't have enough medical experts. So if it is prevented, it would even reduce the cost of such treatment.
Vaccine is good for everyone. So that's, to my own opinion, if you get vaccinated, at least you are preventing yourself. They say to before one is to before armed. You don't prepare at war ground, you prepare before war. So being vaccinated gets you, and it helps a lot. Very, very, very important.
Yes, please, I'm pleading to our federal government. Please, I plead to our amiable president. Yes, I plead to our amiable president to please to come at our rescue, not to make sure that it's everywhere, so that we be fairness to all.
Malaria prevalence in Nigeria is significantly high. The country has the highest number of malaria cases globally. It accounts for 27% of the global malaria burden. With the introduction of the new vaccine, Nigeria expects at least 13% reduction in mortality among children under 5. The malaria vaccine has been endorsed as efficient and safe for use among children between 5 to 15 months. It is advised that parents who have access to this, particularly those in Kebbi and Bayelsa, which would be where the malaria vaccine would be first administered, take their children for vaccination.